What is the Washington Health Trust? Brought to you by Whole Washington for universal healthcare in Washington State. First, what is the Washington Health Trust? It's a trust or fund with its own revenue stream. This fund would then pay all medical bills for Washington State residents, making this a single-payer healthcare system. The Washington Health Trust can come about in two ways. The first way is by passing through the Washington State Legislature. Bills are currently active in both houses. The second way is through an initiative campaign that can make the ballot be approved by Washington State residents. Now, the different parts of the trust. Part 1, who will it apply to? Part 2, what it will provide to residents. Part 3, how it fits into the current system, what it will replace. Part 4, costs for individuals and families. 5, the board and the selection process. And 6, the funding of the Washington Health Trust. Who will the Washington Health Trust benefits apply to? All Washington State residents, including citizens and non-citizens, the employed and the unemployed, those who are sick and those who are healthy, old and the young, those with Medicare, Medicaid, Apple Health, etc. There are no exceptions. This is for everyone. In addition, it's available for some non-Washington State residents. Part 4, the cost for individuals and families. The cost to individuals will be taken out of gross wages, and it will be 0 to 2%. The employer determines how much the employee is on the hook for out of that variable portion for all 19 and older members of a family. So, for example, family income is $90,000 per year. Then the employee would pay at most $150 a month. If their employer covers their portion, they would pay nothing. Unemployed people, children, etc., cost nothing. Those who are making less than 300% of the federal poverty level are also not required to pay into this tax. Most prescriptions are included. Generics are covered, and for those that aren't, there's a yearly cap. The most you'll pay is $250 per adult per year. And there is, again, no charge for those under 19 or those making less than 300% of the federal poverty level. Part 5, the board. The Board of Trustees will administer the funds gathered and consist of 17 members. The members will have expertise in healthcare financing and delivery, business interests and outreach, labor concerns and relations, and include health professionals and medical researchers. The exact makeup of the board will include a representative or the secretary of the Department of Health, a representative or the director of the health authority, a representative or the insurance commissioner, a representative or the director of Office of Equity. And those are the 4 government officials or their representatives that sit on the board. The next 4 members are all submitted by the House and the Senate, both by the Democrats and the Republicans, 1 each. Number 9 through 17 are last 9 trustees. They will come from consumer, label, tribal governments, civilian people coming in to oversee this board and to provide their expertise and opinion. If one of the trustees is not doing their job, they may be replaced by the governor, but only if there is significant evidence of wrongdoing. Part 6, how the Washington Health Trust will be funded. This is the breakdown. Employers contribute 4.5% to 10.5% of wages, depending on how large the business is. The smaller businesses will pay less, 4.5% to 6.5%. And the businesses with over $3 million in gross annual profit will pay 10.5%. And employers may deduct 0 to 2% from employee payroll, as was covered in the family portion of this. Sole proprietors will pay 2% of earnings, of which the first $15,000 won't be taxed. And investors will pay 5 to 9% of capital gains. The first $200,000 won't be taxed, There will be a 5% tax between 200 and 250,000, and there will be a 2% tax above 300,000, which is added to the 7% for education that Washington State has already approved, making a 9% tax. There are exemptions from this, big ones including funds used to purchase a primary residence, retirement accounts, and home sale. Some highlights from that. It's small business friendly. It will actually lower costs for small business owners. A majority of the funding comes from employers who are already on the line for providing for employee health care through their side of the premiums. And the capital gains tax portion does not begin until $200,000 or more. Is this too good to be true? No, it's not. Around 30% of medical spending goes towards private insurance companies. This eliminates that spending. So even though we're covering more people, every single estimate that has been done for whole Washington has shown that it will reduce overall government spending. So better coverage, more people covered, less spending. And that less spending should be around 5 to 15% less spending on healthcare. And as the uninsured get preventative treatment, it's likely more savings will be realized as more people live healthily. How can I help? If you're interested in helping this happen, consider volunteering with us by going to wholewashington.org. Pledge to sign our initiative while you're there. Donate. Contact your state senator or representative to tell them to support our bills. And lastly, just tell as many people as you can about us. The more people that know what an amazing option this is, the more likely it is that this happens.